I'm Dr. David Hill, and today we're going to be talking about asthma and dehydration in infants. So, this is sort of a hairy topic. Let's try and break this down a little bit. First of all, asthma in infants. Infants certainly can have asthma, but sometimes it's difficult to know whether a wheezing infant has asthma, an infection, or both. What are the signs we look for? Well, respiratory distress is the #1 sign I'm looking for. I'm looking to hear if the infant is wheezing. Is there a high-pitched sound when the infant breathes out? Now, the rattly, gurgly sound you might hear with a cold is not really a wheeze. We actually have a special word for that. That's rhonchi. When I think wheeze, I'm thinking a very high-pitched sound. Often I can only hear it with a stethoscope, not until I listen with the stethoscope to the chest. There are other signs. Do you see skin pulling in between the ribs or under the rib cage or over the rib cage at the base of the throat? That's a sign of respiratory distress. Do you see that the nose is flaring with every breath? That suggests your baby is working too hard to breathe. Can you see the abdominal muscles crunching up every time he or she breathes out? If it looks like they're doing Pilates or some sort of core workout, that's not right. Finally, if you notice that your baby is breathing too fast, that can be a really significant sign that something's going on in the lungs, asthma, or something else really serious. How fast is too fast? Well, generally, I don't expect an infant to breathe more than 40 times a minute when counted over the entire course of a minute. If they start breathing more than 60 times a minute, here's where the dehydration comes in. Because a baby who can't breathe can't reliably drink. Once they get up to 1 breath a second or so, it gets very difficult to stop breathing and swallow fluids. So these babies tend to get dehydrated. What does that mean? Well, if you're worried about your baby's breathing, something about it seems not right, get there with a watch and try and count the breaths. If there are more than 60 breaths in a minute, your baby really needs to be seen urgently for breathing problems because he or she may not be able to drink enough to stay hydrated. Talking about asthma and dehydration in infants, I'm Dr. David Hill.